everyone. Uh, Welcome back to my YouTube channel. This is Dr. Naren Patwa from Department of Repertory. Uh, as we have been discussing classification of symptoms in our last class, today we will be discussing classification of symptoms according to Dr. William Boericke, and we'll be differentiating classification of symptoms due to various doctors and various pioneers and various stalwarts, that what kind of difference was there in the classification of symptoms of an individual. Now we'll have a look on what kind of editions were there in 1901. It was the first edition that came in, and then in the second edition came in 1903, third in 1906 plus repertory part, fifth in 1912 plus repertory part, sixth in 1916 plus repertory part, seventh, eighth 1922 plus repertory part, ninth 1927 and repertory part, and the 1998 2001 augmented and re-augmented version, right? So now what was the philosophy? It's basically, it comes under the heading of clinical repertories, and it is the most frequently used clinical repertory to be known till yet, because if you know stuff, I've been to different stalwarts practitioners like Farooq J Master and Dr. R.P. Patel and various others, Dr. J.D. Daryani and all. So what I found was this Dr. William Boericke repertory was must on every doctor's table. So it's basically a clinical repertory, and it shares all the clinical experience to be discussed in the cases, right? So it does not follow any philosophy, because it is based on clinical aspect. Now, what is the plan and construction? Now, the plan and construction we will discuss. Now, the entire book consists of three parts. The first part consists of materia medica, second part consists of repertory, third part consists of miscellaneous, consists of index to repertory in the 9th edition, therapeutic index, and list of common names and remedy. So the first part again is materia medica, second part is repertory, third part is miscellaneous, right? So it is like that. Now now what is again, we'll be going into deep details about the repertory. So the what we know about this repertory will be discussing is that first, it is the list of pharmaceutical and Latin name of remedies. 50 Indian homeopathic drugs are to be are being displayed in the repertory in the last part. Relationship of remedies by Gibson, Miller, and sides of the body from Bonning-Uson's later writings. Various kind of drug affinities are to be are displayed in the book, and essentials of rare and uncommon remedies. So these are the key factors, or these are the different factors which differentiates William Boericke from other authors. Now the gradation part, it is again a clinical repertory, as I've told you in my earlier classes. Now it basically is under two grades, that is, it is divided into two grades. The first grade is italics, most verified clinical remedy, that is of 2 marks, and the second grade is ordinary Roman, that is 1 mark. So this basically clinical repertory shares only two gradings of symptom, as it is a clinical repertory. The first is italics and the second is Roman. Now, right? So now the chapters we'll be discussing is, the first chapter we'll be discussing is mind, the second is head, third is eyes, ears, nose, face, mouth, tongue. It is all again head to toe in format: taste, gums, teeth, throat, stomach, urinary, male, female, sexual system, circulatory, locomotor, skin, fever, and etc. So it's basically a mind to head to toe kind of arrangement of chapters in this repertory, right? So now the next slide is the division of section of repertory is arranged according to Henneman's schema. Basically, this repertory is, again, I must tell you that it is based upon Henneman's schema of he follows the Henneman's schema of repertorization, or the like the formation of repertory is based upon the Henneman schema of repertories. Now the heading and the subheadings and specific condition arranged in alphabetic order, like mind, awkward, brain fog, and catalepsy. So basically, the subheading is arranged. The subheading and the specific conditions arranged in this are in the alphabetical order, right? So this is all into continuous stuff. Now, the total number of remedies shown in this particular uh, repertory is 1409. Medicines index shows 14 medicines, 1414 medicines. 5 medicines reappear. The example Simisifuga and Actia racemosa, which are the one on, and other remedies are acid nitricum or nitric acid. So these are some of the remedies which can be repeated or reappear in the repertory. Now the italics remedies are most commonly clinically verified. Now the basically clinically verified remedies are also called as polycrase remedies, and they are basically based upon regular and repeated clinical verification by various doctors, right? So many new and unproven remedies are also added because as per rare medicines are into fashion to nowadays. So it's basically the new approach coming from research, and the previous revisited or the verified approaches are also there in the book. So it is that ways. Now the next slide. Now arrangements. Arrangement number of remedies 1409. The arrangement shows that index of 1414 medicines, 5 medicines reappear. Example Semisifuga, Actia racemosa. Italics remedies are most clinically verified. Many new and unproven remedies are added here, right? So this is basically the arrangement of remedies. Now it's basically mind, the first chapter. It contains about 30 rubrics. The first rubric is awkward, and the last rubric is stadium vitae. Emotions, fear, under mood disposition, anxious is given, aversion to mental and physical work, hypersensitive, mild, yielding, jealous. Basically all the mental symptoms are arranged in such order that it could be differentiated well. Now it again head started from brain, ends with vertigo, inflammation, tumors, sclerosis, like some brain pathology present under rubric brain. Cellular diseases, cerebral diseases, headache, vertigo is given under this heading. Okay, eyes consist of 38 number of rubrics, started with brows and end with vitreous opacities. All parts of eyes are given under chamber, choroid, ciliary muscles, conjunctiva, cornea, eyeball, etc. Many diagnostic rubric like cataract, glaucoma, vision given as rubric, myopia, diplopia, all the rubrics which are related to disorders of eye are placed like this in this order. Now ears contains of 15 rubrics. Chapter starts with auditory nerve and ends with tinnitus. Aurium, auditory nerve, auricle, ossicle, tympanium, hypersensitive, eruption, scurement, deafness, tinnitus, aurium, discharges. Now nose, it again consists of 11 rubrics, and with many subrubrics, started with affection and ends with ulceration of septum. Now external nose and internal nose are given as rubric. Types of discharges, sinuses given in the nose, sense of smell, alike. Mouth, chapter consists of 8 rubrics with many subrubrics. It started with breath and ends with ulceration. Lips, external palate, external mouth, inner mouth, lips, palate, etc. Tongue, it consists of again 22 rubrics: coating, conditions, eruptions, psoriasis, paralysis, pain, protrusion, difficult. Consist of only 2 rubrics: lost and perverted. Now the taste part is again, it is of 2 rubrics: lost and perverted. The one is the loss of taste, and perverted again is basically the change of taste, or it could be defined in such a way. Like gums consist of 12 rubrics. And now again we go on abdomen. It is of 41 rubrics. Urinary organ, in which kidney, urethra, urinary flow, urination, all are arranged in this way. So basically it again we have a concept of clinical repertory in the mind. So it is basically a clinical repertory. So we will be discussing this clinical repertory like this only. Now again local immune system consists of 911 rubrics with many sub rubrics, that is axilla, back, body, extremities, coccyx, rheumatisms, etc. And now this respiratory system, it consists of uh, bronchial asthma, chest pain, cough, larynx, lungs, respiration, dyspnea. Skin consists of 91 rubrics, starts with acne, ends with pitlow, bromidosis, malaria, oily skin, psoriasis, psychosis, and etc. Generalities 43 rubrics. The important rubrics is chapter is obesity in childhood, chronic disease to begin treatment, sunstroke and compliance. Now modalities. What are the modalities? Aggravation and amelioration. Aggravation consists of 204 rubrics and amelioration consists of 124 rubrics. Important subrubrics are excitement, emotional excitement, brushing teeth aggravation, conversation aggravation, sun pain aggravation, drink warm, oil application, smoking and combing hair. So these are some important sub rubrics which are present here, which can be studied. Application and adaptability. Now what is the application? As we know that it is a clinical repertory where the pathology or diagnosis is clearly marked. It could be a very useful book for treatment or cure basically. Now the cause is clearly indicated because it is again a clinical repertory. Presence of concomitant is there, modalities are well marked, lack of mental symptoms are there, presence of sensation and location are there. Now what are the advantages of this repertory? First of all, it is again a clinical repertory. It lot of clinical rubrics for snapshot prescription. One-sided disease can handle easily, consist many rubrics of sub rubrics in every chapter, easy to prescribe, systematical arrangement according to Hahnemann schema. This book contains well-known verified characteristic symptoms of all medicines beside other less important symptoms, aiding the selection of curative remedy. All the new medicines and essential or published clinically experience of the school have been added in this book. Now what are the drawbacks or the disadvantages? The first is only two kind of gradation is present, so that makes it very confusing to select more symptoms or so to cover more medicines, because again it is under two headings, that is two gradation only. One is I've told earlier. So many old terminologies is used. Example sunburn, which is called FLIS. Many chapter consist of misspelled rubric, so confusion comes. So basically rubrics are, some of the rubrics reappear, some of the medicines reappear, some of them are misplaced. So this creates a confusion in the mind of the physician. Many unapproved remedy also indicates here, like pteridine, sulfone. Many rubrics or subrubrics have only single remedy, very less number of cross reference present. So thank you. This was a short intro about Dr. William Boericke and its clinical repertory. We'll see you in my next class. Thank you for listening. Take care.